Hi, everyone, and welcome to our presentation on navigating Canada's health systems. This is a presentation where we're really trying to help share information about how you can advocate for your health if you're living in Canada or accessing services in Canada. My name is Rachael Manion, and I am the Executive Director of the Canadian Skin Patient Alliance. The CSPA was formed in 2007 as a national not-for-profit organization that is a home for all people in Canada who are impacted by any hair, skin, or nail condition. And I'm joined here today by my colleague, Kaitlyn Beyfuss-Laski from Lymphoma Canada.
Hi, everyone. Thank you for the introduction, Rachel. I'm the Manager of Patient Programs, Research, and Advocacy with Lymphoma Canada. And Lymphoma Canada is a national Canadian charity that for 23 years has worked to empower the lymphoma community across Canada through our mission in education, support, advocacy, and research. So without further ado, I think we'll get started with the presentation. Thank you all for joining for us today. We have a lot of really great information to touch on, and I'll get going on that. So just to provide a brief overview of what we're going to be talking about today, we're really going to be looking at just what the cutaneous lymphoma landscape is like in Canada. We're going to touch on the experience, challenges, and ways that patients can advocate throughout their clinical journey, touching on sort of the main points of diagnosis, treatment, and remission and follow-up care. And also then Rachel will kind of take a bit of a different direction to discuss about how to access treatments in Canada, how it works, what existing challenges there are, and how patients can be more involved throughout this whole process. Lastly, we'll touch on just some resources for patients, different supports that might be available for you within Canada. So we'll provide a bit of detail for that. Great. So going into cutaneous lymphoma in Canada, what the landscape currently is like. As you may know, so just generally to start off with, what is cutaneous lymphoma? And these are a class of non-Hodgkin lymphomas. It represents a group of lymphoproliferative disorders, and they're characterized by the movement or infiltration of malignant T cells into the skin. It is the most common type of skin lymphoma, and there are many subtypes of cutaneous lymphomas, each with their own clinical course. They may have different symptom presentations. They can have different treatment options available as well. So how this type of lymphoma develops is not really known, but research is underway to better understand this. So based on data that has been collected by Canadian researchers, there's a bit of a better understanding of the incidence of cutaneous lymphoma across Canada. And an important secondary finding of this study led to possible explanations for why incidence rates can differ across the country. So the incidence rates of cutaneous lymphomas in Canada were on the rise during 1992 to 98, then stabilized to an actual similar level to what is seen in the United States. So this research actually further highlighted an important correlation between environment and external triggers and the incidence of cutaneous lymphomas. And the majority of cases were actually found in major industrial areas of cities, seaports, and transportation junctions. So as you can see on this graph on the right of this page, you can see how the incidence differs across the different provinces. And as you can see in Nova Scotia, Newfoundland, and Labrador, and New Brunswick, there tends to be these higher incidence rates. And this might be an example of the increased exposures that may be present within these provinces, such as agriculture, forestry, and metalworking. So this research just provided, sort of that initial understanding that there could be some kind of environmental impacts and correlation, but there is further work being performed to better understand this. So to kind of talk about the Canadian landscape and how cutaneous lymphoma sort of fits in, what the prevalence of the subtypes are, I'll just briefly touch on some Canadian research. So the incidence of cutaneous lymphoma worldwide has demonstrated about a 2 to 3-fold increase during the last 25 to 30 years or so, and has ranged between about 5 to 11 cases per million individuals per year, depending, of course, on the subtypes and, of course, the examined year range. So in Canada, the incidence rate of cutaneous lymphoma has increased steadily during the 1990s. Like I had mentioned, it stabilized at about 11 cases per million individuals per year. And this is kind of similar to what's seen in the United States, where the incidence rates of CTCL were on the rise from about 1973 to 98, and it stabilized at about 10.2 cases per million per year. So it shows a bit of a geographical continuity between the North American countries. So while cutaneous lymphoma has been shown to affect individuals of almost all different ethnicities and age groups, and both sexes as well, a lot of studies have consistently reported that cutaneous lymphoma can affect patients of typical profiles and in classic body sites. So this, the mean age of diagnosis in Canada was reported at about 59.4 years, and the median range across other countries such as the United States, the United Kingdom, it tends to be between this age range of mid to late 50s, so between 54 to 58 years of age. And there have been marked differences between different ethnicities and different sexes. More males tend to be more often diagnosed with cutaneous lymphomas than females. So there is a bit of differences. In Canada, based on research, the most common cutaneous lymphoma subtypes are mycosis fungoides, CD30 positive anaplastic large cell lymphoma, both the T cell and null cell subtypes, and mature T cell lymphoma, which is not otherwise specified. And these are the most common. Generally, mycosis fungoides actually tends to be the most predominant type of cutaneous lymphoma, shown sort of across the different countries, mostly accounting for between 40 to 60% of all cutaneous lymphoma cases. And as discussed on the previous slides, not only is clustering of cases being observed where there is a heavy industrial presence in Canada, but this is also being seen in other countries as well. So this sort of non-random distribution of patients argues that there could be some type of external environmental, occupational, or behavior triggers that can exist. And a lot more research is being done to understand this a bit better. So now I'm going to go into the clinical journey, discussing a bit more about, those main phases that patients will go through: their diagnosis, their treatment, and into remission and follow-up care, and providing a bit more information throughout each of these phases about what the general patient experience is, what challenges are currently existing for Canadian patients, and then how you as patients can advocate and become more involved throughout your health journey. Great, so I'm going to start with diagnosis, just generally explaining some of the experiences that Canadian patients might go through during this phase of their clinical journey. The experience of patients can differ greatly, as cutaneous lymphomas can appear with many different types of symptoms, and the most common presentation can be a rash. However, there are still many differences with this type of rash that is experienced. Patients can have patches, which are flat, scaly areas on the skin that can be pink or red or even a different pigmentation. There can be plaques, which are raised, thickened rashes on the skin that can often itch. There can be papules, which are small bumps that can look like pimples or a rash. Tumors, which are solid dome-shaped masses that are a certain thickness, or even just general reddening of the skin. So you can have one of these or a combination, and these can be existing for a long period of time, perhaps before they change or progress, that may make you want to seek medical care. Because of these different presentations, the patient's primary care physician can refer them to many different specialists, and patients will also often receive different diagnoses before they actually receive their diagnosis of cutaneous lymphoma. And unfortunately, a lot of the time it's realized there is a false diagnosis when the patient has already started a treatment for another possible diagnosis that was not the actual cutaneous lymphoma, but for another presumed condition. And the patient not responding to this treatment is indicative that it could be something else. So the patient will then, of course, have to go through the repeat process of being referred to another specialist, undergoing a new set of tests, and hopefully this time receiving the correct diagnosis. So the diagnosis will generally be performed by a knowledgeable dermatologist or hematologist or a medical oncologist. And as cutaneous lymphoma is a type of lymphoma, you will generally be seen by a hematologist at least once. There are a number of different tests that a patient may undergo to receive their diagnosis, and this can include a complete physical exam involving a thorough skin exam. It can involve biopsies, blood tests, and possible imaging tests as well. to determine how widespread your lymphoma is. And your diagnosis will generally be confirmed by a dermatopathologist or a hematopathologist with expertise in cutaneous lymphoma. These specialists tend to have experience in performing the specific tests and chemical tests on your biopsy tissue to receive this diagnosis. So, of course, based on the different presentations of cutaneous lymphoma, there are a lot of challenges with diagnosis. And as such, the duration from the onset of skin symptoms to diagnosis can take many years. So patients with cutaneous lymphomas can typically have, these types of different presentations of their rash. It could look like other conditions, eczema, psoriasis, or drug eruptions are common differential diagnoses. You, of course, might have to be referred to multiple healthcare providers. Patients will often require a number of diagnostic tests, especially if they are being referred to a number of specialists. Further, even if cutaneous lymphoma is suspected, there can be a number of challenges in diagnosing it correctly. So multiple biopsy samples may be required depending on how your disease presents. For example, punch biopsies provide a greater sample volume to perform the specific tests required by the pathologist to confirm your diagnosis. However, if you are receiving a punch biopsy, you may be required to stop certain treatments that you might be on, like steroid treatments, for a certain amount of time in advance of your biopsy. And this, can be kind of impactful to the patient, especially if they're relying on steroid treatments to manage some of their symptoms. You, of course, also do need a knowledgeable hematopathologist to access staining for proper testing. And even with cutaneous lymphoma, as there are many subtypes, some subtypes can be more difficult to diagnose than others, and of course may require further samples or tests. So as mentioned, patients with cutaneous lymphoma, depending on the disease subtype, can present with a spectrum of clinical presentations. So this can include, like I had mentioned, different pigmentation patches, different types of rashes or papules, or tumors, and they can look very different. And as such, they can be diagnosed possibly as a different type of condition. So based on the research actually with Lymphoma Canada that we conducted, a lot of the more common diagnoses for patients with cutaneous lymphoma included dermatitis, included eczema, even included allergic reactions and psoriasis. So it goes to show that patients might have to go through multiple tests, through multiple diagnoses before they do receive their diagnosis. And further, as cutaneous lymphoma can present in so many different ways, it's considered a mimicker in dermatology. So in fact, it can be difficult to diagnose, especially in early stages, and on average can take a number of years to establish a definitive diagnosis since presentation. As shown by our Canadian data, the majority of patients took over a year to receive their correct diagnosis, and kind of across the world globally, on average, it's around 6 years to receive a diagnosis. So some of these, some patient quotes I just wanted to share with you about their experience with their diagnosis of cutaneous lymphoma. Some patients said it took at least 6 months, and they did receive other diagnoses. Symptoms started over 2 years ago, but again, thought it might have been related to other conditions until of course, it advances to a bit more severe. Patients might have to undergo a number of biopsies, especially if there may not be enough skin presentation to take the biopsies from. Patients can be misdiagnosed for a number of years, probably had it for a number of years before their diagnosis. And as cutaneous, of course, is rare, it can be difficult to find specialists within your location. So these were just some patient quotes that we thought really highlighted some of the challenges with diagnoses. Now, throughout your diagnosis, patient advocacy is very important. It's important for you as a patient to have proper communication of all your signs and symptoms with your doctor, and for how long you've been experiencing some of these, because this can help them diagnose your condition earlier. And even after diagnosis, it's extremely important to still have this type of open communication with your clinicians, because it might indicate if your disease might be changing. So it can be hard to remember everything related to your symptoms. We always like to recommend writing it down and sharing this information with your doctor as a good way to approach this. You want to ask your doctor as well if they're confident in your diagnosis. So the pathologist report may be unsure of the diagnosis, and therefore you do want to make sure both your doctor and your pathologist are confident in the diagnosis, as you don't want to, start receiving incorrect treatment. It's also important to want to ask for a second opinion related to your diagnosis. It's important for you as a patient to feel confident in it. And so you can ask your either primary doctor or even your doctor diagnosing you or your specialist for a second opinion, or to be referred to another doctor to just review the results of the pathologist report. As a patient, you do have the right to access all of your relevant documentation and healthcare documentation. And it's important to have this available in many places. So making sure that your primary care doctor has this information, your specialist, including your oncologist, and as well your dermatologist have this information. And then you as a patient have this information to make sure that you're following along with your healthcare through these reports. And importantly, asking for a referral to patient support groups. So there are a number of support groups available that can put you in contact with other patients at different stages of their journey, who can provide you with some advice and guidance based on what they have gone through. So now we're going to change a bit of gears. So after that diagnosis, sort of moving into what treatment will look like for Canadian patients. So based on whether you're diagnosed with early or late stage disease, you might have a different experience with your treatment options and what's available to you. So the staging of your disease answers important questions. So for example, how much of your body surface is covered by your lymphoma, your lymph node involvement, blood involvement, and organ involvement. And depending on how advanced it is, what therapies are available. So before I go into speaking about some of these therapy options available to patients in Canada, we really want to highlight the importance of speaking with your doctor to determine the best treatment option for your cutaneous lymphoma, as they best understand your health and diagnosis and can provide the best recommendation for you. So some of these options that we talk about might not be available for you. So I'm going to kind of divide up the section into two parts. First, talking about early stage disease, and then talking about advanced disease. So patients with early stage lymphoma, it's often skin involvement. The approach for these patients generally is managing the disease and making it as symptom-free as possible. And most treatments offered are conservative. So of course, making sure that the treatments themselves are not worse than the disease. And it's possible, treatment-related side effects. And treatment can generally be provided by dermatologists as well. So some options include skin-based treatments. So this can include topical steroids. Patients can take this for several years and can spot treat as well. There's, more extensive disease might involve light therapy, such as narrowband UVB 311, which is sort of the most common. It can involve nitrogen mustard or mechlorethamine, which is a topical chemotherapy, or oral retinoids. Now, for advanced stage disease, patients do tend to be a bit more sick. It does behave more generally like typical lymphomas. And the approach for these patients is more intensive, so treating sort of the spread of lymphoma. Now, different options can exist. So radiation is an option. Cutaneous lymphomas are very sensitive to radiation. So it can be sort of in low doses to tumors or lesions sort of on the skin, or you can actually have total skin electron beam. So this tends to be if the patients have more widespread disease, to give a bit of radiation across the entire skin. However, it's not as commonly used anymore. We do also have immune therapies. So often, first thought for those that are, not behaving very aggressively, and this can include oral retinoids, it can include interferon and extracorporeal photopheresis. And chemotherapy options can also exist. However, it's important to know that there are a lot of agents available. These options, unfortunately, are generally not very curative, and patients will have to go through multiple lines of treatment. And this tends to be often applied for more aggressive lymphomas, and options can include the following as listed. Now in Canada, there are also quite a few new agents as well, but there are challenges with some of these new agents. None of these are really perfect, and most tend to have partial responses. They can be hard to predict which one to go by, as obviously you want to individualize treatments, and funding access can also be challenging. Further, sort of with some of these challenges, some of these agents can include inhibitors, and I have them listed on the right over here. But there are issues with these. None of these are perfect. It's hard to kind of predict, and important to consider also distance to the cancer center. So versus having IV treatment or oral treatment, and Rachel will touch a little bit more on the funding access issues and challenges in the latter part of this presentation. So going on just generally with some treatment challenges, like I had mentioned, most patients will tend to go through multiple lines of treatment as this is a chronic disease. There are a lot of new agents available, so it can be challenging for the clinician to predict, the best response to certain agents for patients, and sometimes testing might have to occur to see how the patient is responding. Sometimes there can be challenges with adhering with oral medications. For chemotherapies, like I mentioned, no option is generally curable. They tend to just control the symptoms the patient is experiencing and control the disease from spreading. And of course, frequency of treatment and funding access across Canada. Now with treatment, I think this is probably the place where patients can have the most input and advocacy related to it. And it's important that you do feel that you are involved in your treatment decisions. So we find it's important to actually speak with a drug access facilitator at your cancer center, understand what treatments are accessible to you and the financial impacts. So the drug access facilitator will work with you, and this individual is very knowledgeable about the province and any institutional regulations to provide access for you to newer therapies, especially coming out. It's also important to ask about what treatment options are available to you within your province. If not available within your province, are they available in other provinces? Are they available outside of Canada? Just knowing what treatment options are available to you at your stage of disease at this time, and also preparing for the future as well. So again, speaking with your doctor, speaking with the drug access facilitators who know about the different special access programs and support programs for patients. And also asking if a clinical trial is an option for you. So being involved in clinical research, getting access to newer therapies that are coming, in pipelines is important. So speaking with your doctor, if there aren't very many options for you at your current stage, is important. Now going on to sort of that period of either remission or long-term care or follow-up care. Patients are generally during this time coming to terms and accepting that they do have a chronic disease, that they are, may not be able to do everything that they used to be able to do. There are different resources and support groups available for patients during this time to use to help them cope with their disease long term. Patients, during this time are generally dealing with the side effects of treatments. These can be short-term side effects. So these can be while you're actually, receiving treatment. It can, be after you're done receiving treatment, or it can be, appear years later sometimes as well. So it's important to make sure that you're being aware of what different side effects can occur, and you're speaking about these side effects with your doctor. So based on actually the recent Lymphoma Canada report card that we released on the Canadian lymphoma patient experience, in follow-up care, the greatest challenges that patients are facing that impact their quality of life is really their fear of disease becoming worse or progressing. But it's important to know there are different outlets and resources that patients can use to cope with this fear of recurrence, and these can include support groups, education, having an education and knowledge about the future, and different treatment options that might be available. So within this time, there are many challenges that patients are facing. The fact that this type of lymphoma generally isn't curable and is long-term, it's something that you as a patient have to dedicate your time to, understanding your disease, and working with your doctors to manage your symptoms as you move throughout this remission and follow-up care. Secondary cancers are also quite common, so it's important that you take care of your skin through sun protection, making sure you're washing with gentle products. Treatments can also be immunocompromising, so it might require extra safety precautions for patients, such as perhaps not being in large gatherings, using protection equipment, things like that. Patients also, of course, might be still dealing with the symptoms even during treatment or after treatment, and also treatment-related side effects. And this might require lifestyle changes. So you might not be able to do the same things that you always were able to do before your diagnosis. And lastly, there might not be alternative treatment options if a relapse does occur. However, new treatments are constantly being researched. So like I had mentioned, it's important to stay on top of clinical trials and research and having these discussions about what options are available to you with your doctor. So advocacy, of course, still continues throughout the remission and follow-up care. You can be involved throughout this process. Sharing your experience with your treatment and disease is important. So you can share your story with others, provide others who might be newly diagnosed or going through treatments with what you went through and what, management techniques or coping strategies helped you get through your journey. You can also provide your feedback to, patient groups directly. And this can actually help with developing their types of programs and services. They can also help with this feedback. They can submit this feedback to help, hopefully bring new medications into Canada through the Health and Technology Assessment System. And again, Rachel's going to talk a little bit more about that in the coming slides. It's also important for you to monitor your signs and symptoms and communicate these changes with your doctor. Having that open communication and involved care will help you feel supported throughout your remission and follow-up care journey. Asking, like I had mentioned, for all reports related to your care so that you're knowledgeable of, the experiences you went through. Should you require treatment in the future, you'll have these documents easy on hand. And again, ensuring that your clinicians, your primary care clinician, your dermatologists, your oncologists, all have these documentations as well. Of course, continuing to educate and stay on top of treatment options available in case of a relapse, and joining different support groups. And this is really great for both yourself and for others joining a support group. It helps you to speak about your experiences, share your story, and provide guidance to others that are going through this journey themselves as well. And even through some of these support programs, you can become a mentor to individuals. So again, providing that support both for yourself and for others is great. Wonderful. So I'm going to switch over the second half of this presentation to Rachel, who will be speaking on access to treatments in Canada and a bit more about the landscape and how patients can fit in with this. So Rachel, I will turn it over to you.
Thank you so much, Kaitlyn. That was excellent information, and you did a terrific job presenting it in such an easy to follow way. I really like all of the aspects that you raised about how people can be empowered in their journey. And one of the things that we're sort of making that switch to in the presentation now is talking a little bit about what's happening behind the scenes in terms of access to treatment, and how are all these decisions made? What are all of the factors that come into play? Why does it take so long? And so what we're going to kind of make that shift now from what you can do throughout your own personal journey to how you can have an impact in terms of broader advocacy. And that's a really important piece of what both Lymphoma Canada and CSPA do. Sometimes, the way that things are currently working aren't optimal for patients. And that's really where it comes in to us to say, how can we make this better? What is happening currently? And are there areas where we can make things better for patients? So that's kind of what we're going to talk about now in the presentation. So first of all, wanted to just break down a little bit how treatment decisions get made. And when I'm talking about treatment decisions, it's a little bit different than the conversations that you as a patient or as a caregiver would have with a physician, so with an oncologist or a dermatologist. What I'm talking about now is how decisions are made about which drugs are going to be covered. And there are two sort of overlapping but distinct streams here in Canada. One is about public coverage, so people who are able to take advantage of a public drug plan, so a drug plan that's offered by a government. And then there's private coverage, so coverage that you might have through your union, through your employer, through your spouse, through school. In Canada, we have over 100,000 of those plans. So we aren't able to get into as specific details about each of the different private plans because there are so many in Canada. But we can tell you, and what we're going to walk through now, is how all of these pieces come together. And the reason we're telling you about it is, there's sort of twofold. One, we want you to understand how it works because it's not simple. And the other piece of it is we want you to know that there are a lot of opportunities where you can have some influence, where people want to hear what's going on for you. And there's a reason that groups like Lymphoma Canada and CSPA put out surveys about specific treatments. And we're going to talk about that very shortly. So what you'll see on the screen here, we've got the screen split into public coverage. And again, that's public drug plans offered by governments, federal government, provincial governments, and territorial governments. And then on the other side of the screen, we have private plans. So those are the ones that are offered through employers, unions, and the like. And the first step is the same. So this is where Health Canada has a role as the regulator. And so drugs that are going to be sold in Canada or distributed to patients have to be authorized by Health Canada. And the regulator, Health Canada as the regulator, what they do is they take in all this information from clinical trial data that the manufacturers have run and are sharing with Health Canada, and they're asking really specific questions. They're saying, is this drug safe? Like, what are the side effects? What are the safety signals we need to be aware of? And is it effective? Is it going to do what you say it's going to do? Those are the two main questions that Health Canada is asking. And so that's relevant for both public drug plans and private drug plans. And then I'm going to talk a little bit more about public drug plans because they have the most formal system that these drugs follow. So after Health Canada answers those questions, then what will happen is if the manufacturer wants that drug to be listed on a public drug plan, and this is very common for oncology therapies, then it will undergo what's called a health technology assessment, or HTA. And this is done in Canada primarily in two places, sort of initially. One is by the Canadian Agency for Drugs and Technologies in Health. It's a mouthful, and we call it CADTH. And so that's a pan-Canadian initiative. And what CADTH does is it provides advice on these questions to public drug plans that aren't in Quebec. Quebec has its own program run by the Institut National d'Excellence en Santé et en Services Sociaux, also a mouthful, and we call that INESS. And we'll have some links for you at the end of the presentation in case you're curious about those two processes more specifically. But what the questions that are being asked at this stage are, now that we have this new drug, and Health Canada's told us it's safe and it's effective, or they've worked out how they're going to monitor that if they're not super sure yet. Now that we have this one, we're going to put it in the landscape of all the other treatments that are available here to patients. And we're going to ask slightly different questions. We're going to say, in this landscape, is this specific drug clinically effective? How does it compare to other drugs in terms of its impact on health outcomes and quality of life? And then we're also going to ask, because we're giving advice to people to drug plans that are paying for this, we're also going to ask, is this cost effective? So if an alternative therapy is pennies per day, and this is hundreds of thousands of dollars, how does that compare? And how are we going to make sense of that to make sure that people have the best access to new therapies, while making sure that drug plans are sustainable and that governments can continue to provide funding for them. So that's sort of the public payer perspective. After those questions are addressed through a long report, they go on and then they start negotiating about price and then individual public plans. So BC's public plan and Nova Scotia's public plan, they all take a look at it and figure out if they're going to actually make it available or cover it in their province through their plan. And one of the interesting things about health technology assessment in Canada is that is pretty much the only place where drug plan decision makers are asking patients what their experience is with the existing therapies, what their experience is with the disease, what their experience is with this specific therapy, if they've been part of a clinical trial or they've accessed it in some other way. So we're going to talk a little bit about that in more detail in just a moment. But the reason that we're talking about health technology assessment is because in all of this big list that you see, that's really the standout opportunity for us to share with these decision makers what it's like living with cutaneous lymphoma, what it's like trying to access treatments, depending on where you are in the country, how that's working for you, what the side effects are like, what your hopes are for a good treatment, and how that compares to what you've experienced so far. So after we go through all of these sort of decision points along this process, we have the price negotiations. So this is where public payers get together and they negotiate with the manufacturer to try and determine sort of basic terms and conditions under which they will cover that drug. And there are some really troubling aspects of that process, in large part because it's a negotiation and that's not very public. That's not by design. That's, negotiations aren't intended to be public. And so one of the things that can be quite frustrating is it can be really difficult to tell, even after Health Canada has taken a look at it, even after we've gone through a health technology assessment process, it can be really difficult to tell which drug plans in Canada, of the public drug plans, are interested in covering this or are going to cover it. And so that kind of, it's not very transparent by design, and it can lead to a lot of questions and uncertainty. And we're going to pick up on that in just a bit. After that all happens and they've set out, okay, this is how we're going to structure these agreements. Then you have some individual public plans will take a look at it and look at their specific circumstances. So BC has questions that it asks about how this makes sense in its province. Ontario has questions about how it makes sense in its province based on what's already currently available and the terms and conditions that they've all agreed on. As you can see, this is a very lengthy process. And so at the end of this, they will have come up with a set of criteria that patients have to meet in order to be able to access that drug and have it be covered, if indeed they are going to cover it. So they have a couple of different tools that are part of that. One is prior authorization. So that is, and some of you may have experience with this, where you're asked to fill out a form explaining why you meet the criteria. Explaining that you meet the criteria. And then that goes into the drug plans system. It gets reviewed. And then, you get notice back saying, okay, we're going to cover you, or no, we're not going to cover you. And then you have another conversation about why that is. And then drug plans also use different tools to manage access to things like this. And where new therapies have a higher price or cost, that tends to be where you see a lot of these tools being used. And so if you are experiencing difficulty navigating some of this, please reach out to the CSPA or to Lymphoma Canada, and we will help you. We do a lot of analysis on these programs. We're going to talk in a couple minutes about a new report that Lymphoma Canada has out on this. And so we're also here to help you. If you are having luck with the drug access facilitator or other of the tools that have been made available to you. So that's the public plan process. And that's part of the reason why it can take a couple of years after Health Canada says, we've found this drug to be safe and effective, to actually getting to patients who make use of a public drug plan. And that's because of all of these steps in the middle. when we look at private coverage, after Health Canada has reviewed the drug, some of them we're seeing there's been an increase over recent years in the number of private plans that are actually waiting to see what CADTH says, how CADTH has sussed out that whole piece about clinical effectiveness and cost effectiveness. And so there are some challenges with that, more specifically thinking about, does it make sense? Are private plans trying to accomplish the same thing that public plans are? Public plans tend to be more concerned about population health. They want people to generally to have better health in their jurisdiction. They want people to be able to work. They want people to be able to participate in public life. Or in, participate in their social lives, their work lives, their family lives. Whereas private plans, those are really compensation tools offered by employers or unions and offered by some schools to sort of bridge gaps there in order to often make people more productive, make sure that they're able to continue to work. So, they kind of have different objectives, and there's a lot of questions about whether it's really appropriate for private plans to be looking to public plan analyses and see if that makes sense. So just wanted to flag for you, sometimes private plans will be waiting to see what comes out of CADTH before they make a decision about whether they're going to cover a drug. And just as we talked about with public plans, private plans also will end up with a set of criteria that patients have to meet in order to be covered. And so that'll be based on the clinical trial, how the clinical trials were set up. So what Health Canada says, the circumstances that Health Canada finds the drug to be safe and effective. And then it will also depend on whether they feel it's clinically effective. Should you be failing on other drugs first? That's a very common theme in HTA analyses. And when is that cost effective to make that treatment available? So there's a whole bunch of considerations happening in the background between Health Canada saying, all right, you can bring this into Canada and make it available to patients, and patients actually having this drug be covered for them. My goodness, that was a lot for one slide. Now we're going to talk a little bit more specifically about CADTH. So I mentioned that earlier I mentioned that this is one of the most important places where all of these decision makers look to patients through patient organizations often to say, what's this like in the real world for you guys? And so it's important to know when you see these surveys that come out from organizations like CSPA and Lymphoma Canada, and they're saying, do you have experience with such and such a drug? What we're doing with that information is participating in these processes. So it really matters that we get your feedback. It really matters even if you don't have experience with that drug, because what we want to hear is your experience with being able to access the currently available treatments. We want to know a little bit more about what it's like for you living with the disease. And we're able to condense and put together a lot of that information and share that with these decision makers. They're always very appreciative, and we have seen patient feedback change decision makers' minds about whether to give something a positive recommendation or a negative recommendation. So they really do matter. Can't emphasize that enough, and I'm probably going to say it about 3 or 4 more times. If we are able to participate in this process early on and offer that information about what it's like to live with the disease, what it's like to access, to afford, and to use currently available treatments, what people are looking for out of a treatment. Do they want a cure? Do they want to be able to live longer? Do they want to be able to have less of an impact on their lives, be more social, work more, maybe not work more, but be able to work longer. All of these kinds of aspects that really come from you guys, that when we're able to share that information, it goes into the sort of analysis process that CADTH has. And then what they do is they come out with a draft recommendation, and that draft recommendation gets shared with us. And they say, what do you guys think? Did we miss something? Does this resonate for you? Is there something that we should have considered differently, or something we should have considered and we didn't? And then we are able to let them know, either, yeah, you guys did a great job, we support the recommendation, or, we feel like you weren't really paying attention to this piece, and this piece is really important to patients. So can you please take another look at that? So that can be really helpful. And then what CADTH does after it comes up with its recommendation is it puts together what they call a provisional funding algorithm. Super fancy way of saying where CADTH thinks this new treatment should fit into the treatment landscape in Canada. And when we participate in this process with CADTH, we also get to have input into that as well. So that can be really important in terms of actually making something available in a really useful way to patients, or making something available in a really restricted way to patients. So I can't emphasize enough that your input to these surveys, and sometimes we hold discussion groups, is so important. Don't feel like you need to have tried that drug to participate, to share your stories with us. We treat your stories with a great deal of respect, and people want to hear them. People want to know what it's like, especially the people who are making these decisions. So we talked a little bit about some of these things, just going to touch on them briefly. There are existing challenges with the system. So ultimately, not all the drugs that Health Canada approves or authorizes, as they like to say, not all those drugs get publicly funded. Not all those drugs are on public drug plans in Canada, because they don't always make it through that whole process. And we talked very briefly about those negotiations that happen between the manufacturer and those who are looking to cover the drugs from the public system. And because of negotiations and because of how that process is structured, we're never really sure what's going to come out of that discussion. So there's a lot of uncertainty around that. We do have, there are a lot of people who have some suggestions for how to make that process better, including Lymphoma Canada, which has just put out a new report. CSPA endorsed the report. It's excellent. It's very detailed. So if you love this stuff, that is the report for you. It goes through each of these stages and talks about how we can do this better so that we have better outcomes for patients. Oncology therapies are often some of the higher priced drugs in Canada, and that presents its own set of challenges. And then when we talked a little bit about that whole process and how everything can be different for different parts of Canada, we end up with a system where drug coverage actually varies. It depends where you are in the country in terms of whether you're going to be able to access a specific drug. On the private coverage side of things, pricing of oncology therapies is also an issue there. It's also a challenge to the system, and it's a challenge to patients being able to access these drugs as they become available in Canada. And we also talked about, does it really make sense, or, we raised the question, does it make sense for private payers or private plans to look at public plan analyses when they have a very different set of considerations? So ultimately, and this is one of the key takeaways from Lymphoma Canada's report. And if you have any questions, we do have email addresses at the end of the presentation, so you're more than able to reach out and ask Lymphoma Canada directly. But really, there are three main impacts to patients as a result of this. So we're talking about what we call sometimes we call the postal code lottery. It depends where you are in Canada, what you're going to be able to access, because we don't have a national health system. We have a whole bunch of health systems. And, there are also those really specific criteria that come out of that really long process. And sometimes patients can't meet that criteria. And that can be really frustrating for patients, and it can impact their health outcomes and their quality of life. And when we don't have full public coverage for, the optimal treatment option for you, you may have to consider traveling or taking on other kinds of costs related to treatment. So all of those are problematic. And it's these kinds of issues where Lymphoma Canada, CSPA, where we really dig in and we have these conversations with decision makers to make the system work better for patients. So when we talk about how we're going to change these big policy issues, we wanted to provide you with a little bit of a snapshot into different kinds of these big policy issues and how patients can take action. So you can get involved through the CSPA or through Lymphoma Canada. And these are some of the specific ones that are probably the most relevant for those of you living with cutaneous lymphoma. So when we're talking about accessing care in Canada, improving programs and services, there is an international survey that's led by the Lymphoma Coalition. It's done every 2 years, so you can expect to see another one in 2022. And happily, what comes out of that is information that's collected at an international level that's about Canada gets shared back. And then, for example, Lymphoma Canada was able to produce a national report where we have a better snapshot of what's happening in Canada around different lymphomas. Sometimes there is a specific issue or a campaign that groups have started or patients are interested in sort of breathing life into and running with. And there are some of the tactics that we like to use. So one is often to write a letter to your representative. The federal level, that's your member of parliament, depending what province you live in. That's either your MPP if you're in Ontario, your MNA if you're in Quebec, or your MLA if you're in other places in the country. One of the things that is super duper useful for patient organizations is to be able to share patient stories. We get asked by governments, we get asked by international colleagues, we get asked by researchers, by clinicians, we get asked by manufacturers, tell us what patients are facing, tell us what's frustrating for them. How can we all come together, or some of us come together and try and improve things? So the more you tell us what's going on for you and where you're struggling and even some of the successes you've experienced, the more we're able to take that information and try and make the process and the space better for you. We talked a lot about accessing a specific new treatment in Canada. So you tend to sort of see that as surveys from patient organizations. And often we'll talk about CADITH or INESS or health technology assessment or HTA. If you see any of those words, that's what that's about. And then of course, raising awareness. That is a 24/7, 365 days a year job. So we, as patient organizations, we have all kinds of material and information that we share on our social media channels. So please engage with us. That can be really interesting and useful for you, for us, and for others in your world to maybe learn a little bit more about what's happening with cutaneous lymphoma. And from time to time, we'll have patient story campaigns where we want to hear from you. We want your videos. We want we want you to give us an email and tell us what's going on for you, because we really want to make sure that we are representing you accurately and that we are working on things that are important to you. If you have a real hankering to learn a lot more about these processes, we do have some resources for you. So we mentioned, I mentioned the Lymphoma Canada's national report that came from that international data. And so that is also available on their website. What you see here is actually a white paper, and that's the paper that drills into how this system works in greater detail, the system that I was sort of explaining on those slides, and what we think should change about it. So Lymphoma Canada led this. As I mentioned, CSPA endorsed it. It's an excellent paper. It touches on a lot of really important pieces. And they did a paper a few years ago, and they just updated it. So you can look for that as well. You'll be able to find that at the link below. And of course, these organized these agencies and departments that I mentioned, they also have information on their websites. So CADITH, INESS, and then Health Canada has some information as well. If you are looking for support resources, you can always reach out to us at the three organizations here. If you want to reach out to your local provincial cancer agency, they are the drug access facilitators, and Kaitlyn explained sort of where they fit within the cancer agency and how they can help you. They also have a lot of information and support resources that are local, and they have more information and supports available if you have to travel outside your province. The Government of Canada, more specifically Health Canada, does have a special access program. So all those drugs that haven't even entered into the whole process of Health Canada reviewing the data. They kind of exist in other countries, or it's not really available in Canada. Health Canada does have a special access program. They will have information about that on their website. You can always come and reach out to our patient organizations for more details or for help understanding it, navigating it. That's what we're here for. Pharmaceutical companies, depending on the specific drug, often have a wraparound program called a patient support program, and that can be really helpful for patients as well. We want to thank you so much for being tuned in to the presentation today and for wanting to learn more about how these things work in Canada. It's a lot of information. We are here to help you understand it, navigate it, and find it. So please don't ever hesitate to reach out to us. You can find our information on the screen here. And on behalf of the CSPA, I do want to thank the Cutaneous Lymphoma Foundation for including us in today's agenda. Over to you, Kaitlyn. Thanks.
Thanks. And on behalf of Lymphoma Canada, I'd also like to thank the Cutaneous Lymphoma Foundation for inviting us to present on this topic. Both of our organizations are very involved throughout this. So we hope that you reach out to us, and we hope that you contact us if you have any questions or just to connect with us as well. So thank you everyone for attending.